Welcome to this quick guide video, which will demonstrate improvements in the upgraded version of the EPMA system in relation to quick chart functionality within medication administration workflow for nursing staff. Firstly, as a reminder, up to now in the JAC version 2016 of EPMA, prescribed medicines due for administration that had either a drug note or order note attached did not appear in the quick chart function. In this patient example, you can see that this patient has 7 regular medicines due, and some of these medicines have drug notes and order notes attached. When quick chart was accessed, in this example, only 2 out of the 7 medicines are presented in this view, because the other medicines have the drug notes and order notes attached. Most nurses have been using the chart dose or chart dose and go to next workflow by selecting each individual drug, moving on to the administration tab and using either the chart dose and go to next option or the chart dose option. This is still available in the new version of EPMA. In the upgraded version, WellSky version 2020.4 of the EPMA system, nursing staff will have the option to use quick chart for all medicines due for administration at any given time. Having selected your patient via administration round and your chosen ward as per existing functionality, you can see that for this patient, there are 8 regular medicines due for administration at this time. Again, as a recap, in version 2020.4, the existing functionality of using chart dose or chart dose and go to next can still be used if preferred. However, the quick chart function can be clicked to access the quick chart overlay. And as can be seen, all medicines due for administration at this time are presented within the quick chart function, such as drug not on system, which does have an order note attached. The quick chart screen itself will display a communication zone, clinical drug information function that you can access to find information on the medicines prescribed. The main quick chart screen will display the due date and time for each medicine, the drug name, including the strength and the formulation, the dose, and the alternative dose of mils where applicable. This can be seen in the sertraline oral suspension example. The route for each medicine, a non-administration drop-down list for each medicine, administered date and time, which is currently blank, an information icon that can be accessed to see when the last dose of the scheduled administration was last given, and then a select box for each medicine. Medication is sorted under separate banners depending on the prescription type. In this example, we have regular medication followed by PRN medication, which is split into either or protocols, and standard PRNs at the bottom, such as paracetamol and chlorpheniramine. The witness administration fields are available in this screen for the witness, where applicable, to enter their username and password. To use the quick chart function, click the select box next to each medicine as each one is prepared for administration. Selecting the tick box next to Yasmin will highlight the medicine in green, and the administered date and time will populate with the current date and time. Continue through the list, selecting and preparing each item for administration. In the case of lansoprazole gastro-resistant capsules, you can see the full drug name is not visible. Where this is the case, hover over the drug name to view the full information. Clicking on Select next to lansoprazole flips the screen over to display attached notes. In this case, details of how the lansoprazole should be administered. To proceed to the next step, click on the green Acknowledge button on the bottom right-hand corner to acknowledge the note. Continue through the list of due medicines as you prepare them for administration. In the case of erythromycin, there are 2 notes attached: high alert notification, mainly for the prescribers, but where there are administration notes available, please click on those to view the administration information and click Acknowledge. Continue through the list, preparing your medication. For drug not on system, clicking on the Select button will present notes attached to the prescribed medicine. Notes to appear when charting, in the case of drug not on system, for example, must always be accessed. For drug not on system, this is where the information about the drug to be administered and the dose to be administered can be viewed. And click Acknowledge. Continue the process for all medicines as you prepare them for administration. Focusing on the standard PRNs at the bottom, paracetamol and chlorphenamine. For any PRNs, it is vital that the information icon is accessed to determine when the last dose was administered. In the case of paracetamol, last dose was on the 8th of November at 12:36. For chlorphenamine, hovering over the information icon states that a last dose has not yet been administered. So chlorphenamine has not yet had a dose being administered. Hovering over the drug name for PRNs will highlight any PRN notes. Do view these to determine if doses can be administered. For protocols, the Select button is replaced with an Add option. Clicking on the Add option presents the administration tab as per existing functionality. If a time is entered here, you can see the only options available are chart dose and cancel. Chart dose and witness override is not used. So at this stage, protocols should only be administered and charted where this has already taken place. For chlorphenamine, select. This is a PRN and so will be highlighted in red because the time field will need to be populated once the medication has been administered. Medicines such as stat medication, variable dose medications such as warfarin or chlordiazepoxide, etc., will present at the very bottom of the screen. Once the administration process itself has been completed, i.e. having prepared the medication and proceeded with administering to the patient, it is vital that this takes place before charting in the system. Having administered medication to the patient, the medication must now be charted accordingly. It is imperative that any non-administrations are selected before clicking the chart button. In this example, let's say the patient refused the Yasmin tablets. From the drop-down list under non-administration against Yasmin tablets, select patient refused. Let's say the patient also refused their lactulose. It is important to ensure that the correct non-administration reason is selected. Where a non-administration reason is selected, you will notice the administered date and time fields will revert to the default setting and will not contain a date and time. The non-administration drop-down list can be used for any of these non-administration reasons where these need to be recorded. For example, if a drug is unavailable, you can select drug unavailable. And once again, the administered date and time fields will default to the default setting. If for any reason a non-administration reason has been accidentally entered, click on the drop-down list and revert back to the Please Select option. You will notice that the medicine will now not have the green background. In order to proceed with administration and charting again, tick the Select box to highlight the medicine in green once again. If a PRN has been administered, enter the time using the 24-hour clock. And as previously mentioned, the witnessing administration fields can be used by the nurse witnessing the administration as needed. Confirm that what you are about to record is correct and click Chart. All the selected medicines highlighted in green, including any PRNs, will now be charted in one step. You will be reverted back to the administration tab for the patient, and we can now see all the regular medicines that were presented here have now been charted. All charted medication, as they were recorded, whether administered or not administered, will now be available in the administration history as per existing functionality. From here, you can navigate back to the administration round to proceed with administering and charting medication for the next patient. Thank you for listening. If you have any further questions, please contact the EPMA team as per the usual email and help desk number. Thank you.